we're going to learn in this class is dietary habits having an effect on our caries risk. So what we're going to learn is how we can help our patients, or you can help yourselves, make choices that will reduce your caries risk. There are also things that can prevent caries or reduce caries or even arrest or stop caries development. So these are called protective factors. And we have saliva and sealant. So saliva, if we have a lot of saliva, if we're promoting saliva, that's going to be good because saliva actually can rinse the mouth out and protect our teeth. We all know about sealants now. Their teeth are sealed with a protective coating when their new teeth erupt. So their 6-year molars are sealed, their 12-year molars are sealed, and sometimes even premolars are sealed. So children and people that have been getting sealants since they were young or have new secondary teeth, these teeth are at less risk for caries development because of these protective factors. Also antibacterial. So this would be a mouth rinse that's going to reduce the bad bacteria in the mouth. And then we also have fluoride. So fluoride comes in different forms. Fluoride comes in teeth. You're going to have it in your toothpaste. You're going to have it in your sometimes mouth rinses. It also is going to come in food form. So some foods actually have fluoride in them. And then you can also have fluoride treatments. So all children have fluoride treatments, and then people that might have a higher risk, they might have fluoride treatments done at their dental office to reduce their risk or to arrest the caries progression that they do have. And then diet is going to be a protective factor because we're going to learn about foods that actually can help increase salivary flow, that can help reduce bring up the pH in the mouth or reduce the acidity. All these protective factors can actually tip that scale so we can turn around or reduce our risk. So you're learning a little bit about this in concepts and are starting to be able to see this in clinic. And if not now, soon we'll be able to do that. So what exactly is plaque or biofilm? So it's going to be this like dense matrix of colonizing bacteria. And the bacteria that I spoke of previously is the caries causing bacteria. So 2 are kind of like the lead bad bacteria that's going to cause caries, and it's Streptococci mutans and then multiple different types of lactobacillus. So we call that lactobacilli because it's a multiple lactobacillus. So here's this beautiful picture of someone's teeth, and this, fuzzy white is all plaque. And plaque is a soft film that can be removed with brushing and flossing. But if we do not remove it, it can cause caries. So bacteria is the largest factor that makes up biofilm. And some food particles can make up plaque, but it's bacterial growth is really the number one thing that it's made up of. And if we were to not eat, we would still have plaque. So what we choose to eat is going to change the consistency, though, and the amount of plaque that we have in our mouth. So sugars have a greater influence on creating bacteria. And the problems with sugars is that sugar causes our saliva to become more acidic. So when we're eating sucrose or fructose, that sugar is going to lower the pH. So when we lower the pH of something, we're actually increasing the acid. So we're taking our pH from a 6.5 or a 6.7, and that the introduction of the acid is going to drop that pH to a 5, a 5.5. And it actually is going to drop for an extended period of time. In that time that there's acid in our mouth, our teeth are more susceptible to developing caries, because that acid allows an environment that caries formation can develop. And the plaque is going to, in addition to that, causes more of a risk. So when we have certain choices for foods, foods that are fermentable carbohydrates or foods that are high in sugar, they're all going to break down to sucrose or and then be converted to another polysaccharide called dextran. And those are going to lead to a larger accumulation of plaque than if we were to eat something like a vegetable, raw vegetables, or something more healthy. So texture of food is a great factor in what we're eating and how our risk of caries is going to be higher or lower. So if you think about when we chew, the tops of our teeth are being put together. So we call that mastication. And the friction of our biting and chewing is going to actually allow the food to come off the tooth surface. So if you think about eating a raw carrot, that's actually, or an apple, you're cleaning out your tooth surfaces with that action. Whereas if we were to eat, a bag of potato chips, we know how that feels, that it's, sticking within the surfaces of our teeth. Or if we have like a soft white bread, it's sticky and it's staying put, and it's harder to kind of get out of our teeth. We would have to floss it out or brush it out for it to go away. So a soft diet of foods that are high in carb density or more fermentable carbohydrates are going to promote this plaque adherence or this plaque accumulation. And when we're brushing, it's so important because to brush along the gum lines of these teeth, as we see in this photo, this beautiful photo, brushing along the gum line, that's where that plaque formation really starts. And if it's not removed, then we're going to start to see, this development of caries as that plaque forms to calculus, and now is not able to be removed with floss or toothpaste. So here's just a nice little flow chart of like what needs to happen to form caries. So we know that we're not going to say if you eat potato chips to our patients that you're going to get caries, because we know that potato chips don't cause caries. But in fact, if a diet full of fermentable carbohydrates or high starches with lots of sugar, that's going to increase your risk. So if you were to take someone with more susceptible teeth. So if you think about your back teeth are going to be more susceptible because they're a little bit harder to clean. Maybe the insides of your bottom teeth are more susceptible because that's where the saliva kind of pools. That's where the food can be difficult to remove. We think about the strength of the teeth. Were they developed fully? Do they have soft spots naturally? Do they have restorations? Are these restorations faulty? Those are all the concerns we're going to be having when we're looking at somebody's mouth and we're trying to determine what their risk factors are for caries. Also, we know that we do have these bad bacteria in our mouth. Some people have more of this than others, and there's really no way to tell that unless they were to have a culture. But the two specific organisms that are known to be carie-causing are the Streptococci mutans and the lactobacilli. Acid is a huge factor because we're thinking about how the pH of our saliva is changing. So we want that normal pH of the saliva, which is around 6.5. And every time we're eating, we are changing the acidity or increasing the acidity of our saliva if we're choosing foods that are high in carbohydrates, because as we learned in the previous presentation about carbohydrates, that all carbohydrates are going to break down into sugar. And lastly, but not leastly, because frequency is probably one of the most important factors when we consider caries development is the frequency of sugar. So an example of this would be having your morning coffee with your cream and your sugar, and sitting down and having that coffee with your breakfast. That is fine. But then you have the coffee consumption that might be in a larger cup, let's see, like the Dunkin' Donuts cup, and there's sugar in there, and you're drinking it now for 3 hours. So every time you take a sip of that coffee with sugar in it, you're reintroducing the sugar into your mouth, and that acidity is staying lower longer, or the pH is staying lower longer, meaning the acidity is high. So if it takes a certain amount of time for our saliva, the pH of our saliva to get back to normal, but we keep introducing sugars through whether it's snack foods or meals or sugar in our coffees, that pH is never able to get back up to normal. So that's why frequency is extremely important. So here's our susceptible tooth. So I talked about in the previous slide, what that kind of means. So we're making sure that it's a tooth that's been formed with, gone through its all developmental phases, and it has all those nutrients that it has in it, that there's fluoride in the water, or you're getting fluoride through toothpaste or a rinse or through fluoride treatments. And the risk of developing caries on a root surface is much higher than that of enamel because it's a softer structure. So cementum, which is your root surface, or your dentin, which is within the enamel, that's going to be a much higher risk for caries because it's a softer matrix. Also, a patient that has xerostomia. Now, this is something that you actually, during the intraoral exam, could be something that you detect when you're looking at the salivary glands and you're testing them with a Q-tip. You'd be able to see if you dry that duct off, whether it's the parotid duct, you're seeing is a droplet of saliva forming at that duct. You can also ask the patient, does your mouth feel dry at nighttime or certain points of the day? Do you find that you have to have a lot of water, or that your tongue might be sticky, or your cheeks might feel dry? And then you'd look at their medical history too, because certain medications, you'll notice when you're looking at medications, one of the side effects is dry mouth. So that's something to consider too when you're coming up with conclusions about a certain patient's caries risk factor. So here's our acid, and acid is going to come into play every time we eat something that has sugar in it. So we know that fruits have sugar in them. We know that most breads and rice, crackers, chips, cookies, they all are going to end up being broken down into sugar. And that sugar immediately is going to cause an acid formation, meaning that the pH of the saliva will drop. When I talk about fermentable carbohydrates, the things that we eat that are fermentable carbohydrates, the simplest way to remember this is our baked cookies, crackers, chips, sweets, baked goods are usually all fermentable carbohydrates. So a normal pH in our mouth is around 6.5. So the pH of biofilm is 6.2 to 7. So if someone has a higher caries susceptibility, they might have a lower pH, meaning that their bacteria or their biofilm is more acidic. When we eat sugars or carbohydrate foods that are broken down into sugars or glucose, our pH is going to fall below that normal level, so below 6. We start to see decalcification of enamel when that pH is in the 5s. So there's, 5 to 5, 5.2. And notice I put the bigger number first because if you picture it going down, the higher the pH, the more basic it is. The lower the pH, the more acidic. So remineralization of root surface, meaning if we're going to arrest or stop the caries process, the remineralization has to happen above 6, 6, all the way up to 6.7. We can have the remineralization of root surfaces. When we're eating our snacks or our meals, sometimes it can take up to 2 hours for our saliva's pH to go back to normal. It could range from 15 minutes to, depending on what we're eating, but it could go all the way, stay acidic for all the way for 2 hours to get back up to normal. So you can see if you were to then introduce another snack or, have a sugary drink, now all of a sudden it's not able to go back up to where it needs to be. This is just a cute little graphic. So we have our sparkly little tooth. Here's our bad plaque, the sugar in our foods, perfect examples of fermentable carbohydrates, our cupcakes, our donuts, our cookies, and then we have our time. How often? So have your donut and eat it, finish off with water, and move on. So we're not removing all fermentable carbohydrates from our diet, but we're having them either with a meal, with other things that are going to promote caries, promote the reduction in caries development, like a raw veggies or something. And we're going to just limit our frequency. So having, our coffee in one sitting, or, if you have multiple coffees throughout the day, just drinking it at one time and not prolonging it throughout the entire day. And all these little factors can lead to this sad little tooth with this caries. So here are cariogenic foods. So this is going to be a vocab word, knowing that cariogenic means promoting caries. So something that we don't want. So these are our fermentable carbohydrates. So when we have these fermentable carbohydrates, what happens is, I talked about the carbs are being broken down into the simplest form, which is glucose. And it doesn't really matter which type of sugar you're consuming, whether it's fructose from fruit or sucrose, as long as it is a simple sugar, it can actually synthesize into this form of like a polysaccharide. And one of these, you don't have to know all of these, but dextran is actually known to promote biofilm development, and it creates an easier substance for this plaque to adhere to. So when you're eating throughout the day, you're developing more of this plaque and biofilm, and now this is adhering to the tooth surface. Then take into consideration poor oral hygiene. Now this is when our risk is really starting to go up. So again, not eliminating these things from our diet, but knowing that when you're eating them, noting the frequency, and also making sure that this is when it might be important to brush during lunch if you're consuming more of these fermentable carbohydrates throughout multiple times of the day. That third brushing in the middle of the day is going to act as a way to, break that cycle, because you're removing now all of the biofilm, or hopefully most of the biofilm above the gum line, to help, the teeth be, stronger and less at risk. So this acid, I told you this, it's being formed as these fermentable carbohydrates are being broken down in the mouth. And when we do the digestion unit, we're going to talk a lot about how each type of food is broken down, where it's broken down, and what breaks these different types of food down, whether it's a protein or a carb. So this acid will dissolve or demineralize would be the word for it, tooth surfaces. And it's much more common for that to happen in someone that has recession and they have root exposure or cementum exposed. That creates an even greater risk. So what happens over time if there's a lot of fermentable carbohydrates in the diet, these polysaccharides that are being synthesized through this bacteria or these dextran can stick around in the mouth, and they're forming and staying in certain areas that might be hard to reach when we're brushing or not able to remove all the biofilm, and they can continually cause acid in the mouth and can affect the tooth structures even if we're not eating, because the saliva can still be at a lower pH. So this graph right here will show us the normal pH in the mouth, and then it shows on one side the pH, dipping down, and then how the time. So it shows if you were to eat and your saliva pH is normal at a 6.5 and you introduce a fermentable carbohydrate, you see that this pH has this huge dip dependent on how long what you're eating is going to be, how long it takes for it to climb back up to a normal level. That frequency of snacking, it continues the dip, or you're going back down to an acidic level before your pH has been able to come back to that 6.5 or above. So what does this all mean for us, for students, for dental hygienists? Like, what's our role here? So you're going to be extremely educated when you get out of this program about bacterial formation, types of bacteria, how caries develop, the whole process. And our role is really to be educators to our patients and let them know in the simplest ways how they can help themselves by modifying their diet very simply, increasing their oral health practices at home, using the right tools at home, and being able to reduce their risk and prevent caries. So you're going to have, depending on your work in private practice, in a periodontal office or a pedo office, you're going to see, or most likely see, an array of age groups. So if you're working with children, it's important that you're evaluating their diet and nutrition behaviors, because you're going to be following their oral health probably throughout the stage of their life as they grow up. And it's part of your job, if you start to see a change in caries development, you start seeing that there's cavities, and you have to kind of play that detective and figure out, well, what's changed here and why now is this child starting to develop caries. With all people that we see, we want to assess their risk. Do they have no restorations and very little plaque? You're doing your plaque indices and seeing how much plaque that person has on their teeth, and then educating them and seeing if that changes going forward. Do they have a mouthful of restorations? Do they have a mouthful of old or faulty restorations? Are they taking medications that have xerostomia as a risk factor or a side effect? Do they have dry mouth? Do they eat a very soft diet because maybe they're missing multiple teeth and they're unable to chew crunchier or healthier foods like vegetables, raw vegetables? So just assessing each person on an individual basis and letting them know what their risks are and how they can reduce their risk by changing a few behaviors. We have to teach people, our patients, how to prevent dental caries. Are they using the right products? Do they need to have fluoride treatments? Do they need to, are we evaluating their diet, doing a 24-hour recall, which we'll talk about towards the end of the semester, and making a couple tweaks? to help reduce their risk. So patient education is a huge part of our job, and you're going to find that most patients really welcome any new knowledge that they're going to gain, and they all want to try and be better or do better. And when you see patients, it's important too that you're involving the parents in the decisions you're making, in the discussions that you're having with these children, and any counseling behaviors that you might recommend for them to benefit their oral health. So I talked a lot about frequency. This is your frequency reminder here of how important it is. So what we eat is actually less important than how often we eat it. So I'm not going to tell you to not have a cookie every day after lunch or to not enjoy ice cream after dinner time, but the amount of times you're eating these foods is going to make a difference. So eating a bag of potato chips throughout the afternoon is going to have a higher effect on Caries risk than if you sat and ate the potato chips with your lunch that could be a sandwich or a salad. Because once the food has been eaten, your pH will start to go back to normal. If you don't allow that to happen, your risk for caries, because the acidity in your mouth is going to be greater. It's also true that if you're eating fermentable carbohydrates with a meal, the reduction in risk, or your risk, is reduced because you're eating it, most likely if it's with a meal or right after a meal, you've already had some other things, and we're going to talk about we're talking about things that are karyostatic, so actually reduce your risk for caries. So eating them with a meal, most likely your meal is going to consist of multiple different types of food and not just a carbohydrate. And snacking, I've hit this over the head enough. This snacking, and again, not snacking, but snacking on fermentable carbohydrates increases the exposure. And this is the problem that arises when we talk about caries risk. So this quote just says that if the patient is snacking greater than 3 times a day between meals, so 3 meals a day, then snacking 3 times is 6 incidences of the acidity going up or pH going down, or beverages that contain sucrose, glucose, fructose, or cooked starches. So think of your baked goods and sweets. This increases the acid challenge to the teeth to a high level. So thinking about fermentable carbohydrates, acid, caries, these are all kind of working together to create a higher risk. But not all cariogenic or not all carbohydrate foods are created equally. So we know that fruits have sugar in them, but they're not all going to be broken down the same. So sucrose gets a bad rap, as a fermentable carbohydrate because it's these fermentable carbohydrates are simple carbs, and they're just broken down to form this acid. So fructose also is the same. So when you think of fruits being healthy, fruits sometimes, unfortunately, are high in sugar, and it doesn't matter if it's fructose or sucrose. It all ends up being the same when it comes to acid production in your teeth. So if you think then about consistency of foods, if you compare a raisin to an apple, think about the process of chewing and eating that food. So what's going to happen with a raisin? It's going to be sticky. It's going to stay in your teeth, get stuck between your teeth, and might stay there if you don't eat anything crunchy or have a chance to brush or floss. Think about having a sandwich with maybe some soft bread and finishing that off with an apple. That apple is working to actually clean out the mouth. it could even be removing biofilm because of its consistency. So a couple of examples of fermentable or sticky carbs would be that you may not realize that are fermentable are bananas and raisins. So raisins a little bit easier, but a banana is kind of like a sticky in the sense that it stays on the teeth, maybe more like a film, whereas a raisin pieces would stay in the like the tops of your teeth when you're chewing. But if you're choosing something like an apple, um, apples are going to drop the pH again because they still have fructose in them. But I use the word detersive. So they're going to the pH will go back up, but it's also going to keep other foods from sticking in teeth. Oranges are very acidic. So you think, well, these can't be good because they're dropping that pH. But things like oranges or citrus fruits, they increase our salivary flow. You know that feeling you get when you're really hungry? And if you have something tart, you can kind of feel it in your glands. It's like ooh, that's what an orange does. So what it does, it's promoting salivary flow. Because it promotes salivary flow, that pH comes right back up to normal a lot faster. So on the lower end, like 15 minutes versus taking much longer, more than a half an hour to return. And here are some examples of consistency coming into play. So we know sucrose is really like one of the main things we want to avoid because of it converting into dextran. And when you think of dextran, think of it creating a stickier surface for biofilm to adhere to on the teeth. So that's when consistency of food comes into play. So if you're going to have something that's really kind of sticky or tacky, I think of a banana, maybe the word like tacky, kind of like leaving a film on your teeth. I use the word here adhesive. So think of things like dates and figs and prunes and bananas. And those are things that have a lot of benefit to our digestive system, the dates and prunes and figs and raisins. But if we think about little kids having raisins, kids can have raisins, but you don't want to have a child having a cup of raisins that they're eating all day long, because now again that's frequency. So those raisins are sticking to the teeth and they're spending more time on the tooth surface, being broken down into the sucrose and then causing more plaque adherence. So if you think of something like an apple, it's more like chewy. So you're chewing it longer. So something like I don't know if you've had a dried apricot, but they take a lot of chewing. So that chewing, that mastication can also promote salivary flow. And I gave the example of the apple, this crunchy food that's helping remove biofilm, and you're chewing it, and creating that salivary flow. Just as I said about the citrus foods that are promoting saliva. So I gave you a couple of other good examples. If you don't like dried apricots, which I happen to do, another good snack for you to choose would be a dried mango. So chewy in the sense that you have to chew it, but it's better for your teeth because it's promoting salivary flow. And it's not going to adhere the way a raisin or a prune or a banana would. So what are the foods we can eat? I'm being such a downer here, talking about all these, fruits that are dropping the pH and creating acidity. So when you start to look at your diet summary and you're looking at your choices for snacks, and you're looking at your frequency of your snacking and what your choices are, when we're snacking, we just want to make better choices in the sense that, in this case, we're reducing our caries risk, but also These snack choices tend to be higher in protein and fill us up longer. And we'll talk about that more next week. But these are some great karyostatic foods. So this is going to be the opposite of karyogenic foods. So when you think karyostatic, you're going to think thumbs up. These are good foods. So cheese has a protein in it called casein. And casein actually inhibits bacteria from attaching to the tooth surface. Foods that have fat and proteins tend to be less causative of forming plaque and bacteria or biofilm formation. Nuts, again, this is, a high fat content. Even though these, you think, oh, these could get stuck in my teeth, the consistency of them or their protein makeup, these are going to be great better for your teeth. So they're chewy, you're chewing them more. To break them down, you're creating more saliva and reducing the acidity by raising that pH back up. Good news on the sweet front, dark chocolate. So not all chocolate's created equal, but dark chocolate has a high tannin content, which is actually what's also in red wine, which is the same. And it also inhibits the formation of plaque or biofilm onto the tooth surface. And we know we're learning about this in concepts. If you haven't yet, you will. That xylitol is a type of sugar that's a good sugar. And it is a sugar alcohol. And xylitol is going to actually be beneficial to teeth because it doesn't create acidity. And this is what the ingredient, the sugar ingredient for in most sugarless gums is. And when we eat foods that have xylitol in them, which are few, but if we chew sugarless gum, the xylitol is actually absorbed into the teeth and can cause remineralization. So if we had a susceptible tooth that had a white spot on it that we were watching, an area that we thought might be demineralized, a product that has xylitol in it could actually arrest the formation of caries and remineralize the tooth. So dark chocolate, nuts, we have to watch with nuts. We have to watch our fat content, which we'll talk about when we do lipids. And cheeses, certain types of cheeses. And again, with cheeses, we have to watch our saturated fat content. Nuts have good fats in them. But these are all great snacks that you can have throughout the day. They're going to fill you up and are going to contribute to healthy pH and reduction in biofilm formation. And it's always nice to pair these high protein or high fat foods with something from a different food group. So having like an example would be having peanut butter on an apple, or having some cheese in apple, or having some nuts and carrots. But these are going to fill us up and have great health benefits. So this is just a rundown of some of the terms that we used today and ones that you'll need to know for the future. Karyostatic means that it's going to inhibit or decrease the progression of dental caries formation. Anti-karyogenic is a similar term to karyostatic. So those are going to be foods or sugars that prevent dental caries. And then we have karyogenic, which means foods that could cause dental caries. Those are our fermentable carbohydrates. Acidogenic, so that could be that foods, that's going to be a good term. So these are going to be foods that actually don't lower the pH of our saliva. So if we're eating a food that has the ability, let's say like an orange, so it might lower it very briefly, but it's going to come back up again. So that's a good thing to have. Then we have xerostomia, which is our dry mouth. Remineralization is a tooth or a tooth surface that might be at risk. And the process of remineralization is perhaps using a fluoride substance, whether it be the toothpaste or a fluoride treatment, and being able to repair that damaged tooth structure. Demineralization is the first process in that caries formation. So when we see a white spot on the tooth or an area of discoloration or softness, that might be a demineralization. Once we have caries, then that's something that is going to be much more apparent, and that would be more obvious that is a dental caries. It would be, a hole in the tooth or a very dark area or a soft area. So what are we going to recommend for each other? What are we going to recommend for our patients for the future? So we're not going to eliminate by any means carbohydrates from our diet, because we've learned in this unit how important they are for our bodies. But we're going to think about what types we're eating and when and how often we're eating them. So as a hygienist and being in the dental field, things that we can relay to our patients that are really important are removing the biofilm multiple times throughout the day. So if someone were to have, let's say an example would be a patient that has diabetes, that has to eat small meals a day to be able to maintain their blood glucose levels. That might be a person that you can tell them that they would benefit from brushing 3 times a day versus just morning and night, because they need to remove that biofilm in the middle of the day and break that caries cycle and reduce the bad bacteria in their mouth. Advising a patient that might be snacking too frequently, limiting their snacking or reducing it slightly, but also allowing them to look at what types of snack they're choosing and avoiding too many fermentable carbohydrates such as cookies, cakes, muffins, potato chips, these starchy foods or high sugar foods that are going to be adhering to teeth, creating a change in the change in the acidity, and then causing more biofilm, especially when that person is unable to brush in the middle of the day. But there's going to be times that we make these choices and we're not able to brush, and we do have that sticky food. And simply what a patient could do if they're unable to brush is grab a piece of sugarless gum, take a rinse of water, grab an apple, eat some carrots. Those are all things that we can do in addition to snacking on cariostatic foods that we can really reduce a patient's caries risk. So what we get from this unit about the relationship between diet and caries is that increasing the protective factors within our mouth or within our body, we can actually tip that scale and balance out the risks or those pathological factors like frequency of fermentable carbohydrates, bacteria, or a patient that has xerostomia. And we can gauge that or tilt that risk in an opposite direction by maybe bringing up the salivary flow by having citrus fruits or chewing non-sugarless gum, having fluoride treatments or rinsing with an antibacterial rinse, eating our meals with proteins or cariostatic foods like nuts or cheese, and making sure that our teeth are strong by brushing them, cleaning them, having fluoride treatments, if I didn't already say that, and reducing the frequency in which we have our snacks. Thank you, and that is all.